Hi, everybody. I am Asta Vas, founder of Dental Student Society. Thank you for joining us for today's session and spending your Sunday with us. Welcome, Dr. Kaur, for spending your time with us and explaining your journey. And we are very excited to learn a lot about you. Do you want to tell us more about yourself and your experience? And then you can start by your presentation as well.
Hi, everybody. Thank you for joining, and thanks to you for inviting me for this webinar. So it's my first collaboration, so it's always exciting. And so I completed dentistry in 2020. So I'm just telling you my journey for reference, everybody who's here today. And then in 2021, I joined MPH. That too I did from India, not from USA. I graduated in January 2023, and then I applied for residency programs because the cycle starts in April, May. So then I applied for residency programs, and I just got an invite in the same cycle. So I started this June. It's been 3 months since I started my residency. And yeah, I'm looking forward to hear everybody, your questions. And I've tried to include all the questions in this presentation. But still, if we are not able to cover all those during the 45 minutes, 1 hour, how much time we have, you can always shoot me a message on Instagram and I'll try to make a video on that. Okay, so today we'll talk about the less chosen pathway for practicing dentistry in USA, which is the residency, because mostly people know about DDS. So first, I'd like to highlight what are the differences between DDS and residency. So first, which is very important, is the practicing states after graduation. Uh, After residency, you can practice in 8 to 10 states and not all across US like you can practice after DDS. So the 8 to 10 states, some of them include Illinois, Chicago, Texas. These are some of the states, and the state you want to practice in, you can always go to Google and type, suppose you want to see Texas. So just go type Texas Dental Board and you'll see what are their requirements. You'll see that they have written 2-year CODA accredited program, which means after a 2-year program, you can practice there and you do not need a DDS. So you can always go check on the state's dental board, how you can practice, and these requirements keep changing. Also, one thing, many states allow you to practice after 3 to 5 years of practice after residency. So for example, California, you cannot practice directly after a 2-year residency, but after 1,500 hours, which is around 3 years after residency, you can start practicing in California. This is called reciprocity, and many states offer reciprocity. So you can practice in many states after 5 years. Next is the cost of programs. Before going forward, I'd like to ask everybody, you can take a pen, paper, because this presentation doesn't have the details that I'm talking about. So you can write things that you think would help you. Second, cost of the programs. You can go to Pass Program Finder. I have shared this on my Instagram page. It is a page where you can see all the residency programs. You can go to the particular website of a particular program and view their tuition fee. It is called Pass Program Finder. You can see the tuition fee of every program when you go to that portal and open a specific university page. Compared to DDS, some residency programs have lesser tuition fee. So this is also one of the reasons why you can choose to go for residency, because it's anyway allowing you to practice. Third is exams leading to licensure. I want to emphasize this fact that everybody needs to give INBDE for residency applications. Some universities say give it within 6 months of the interview. So it's varying for every university, but there is no shortcut to it. You have to give INBDE. The exams to practice dentistry in USA remain the same. You have to give INBDE, and during the course of your residency, you have to give the practical CDCA ADEX exam. You have to do this. There's no shortcut. Fourth, dental licensure. The license you get for practicing as a dentist is the same as you get after doing a DDS. Just the state limitation that I mentioned before, but the license remains the same. You get to practice the same way. You get the same license that you get as a DDS. Next, I have been getting a lot of DMs asking about whether we can practice as a general dentist or as a specialist. So the answer is you can practice as both. After doing any residency, perio, pros, orofacial pain, endodontics, etc., any residency, you can practice as a general dentist or as a specialist. It's totally on you. Just depends on the state. Last is the application process. For DDS, you apply through the CAPIT cycle, as everybody knows, but for residency, you apply through the ADEA PASS, which is the PASS portal. So you apply through the PASS portal for residency applications. So how do you start with the application process? This is all you have to do. So it's a little bit overwhelming when you start, but once you're into it, it gets easier. So you should always aim for doing the NBDE first rather than the TOEFL, because TOEFL is only valid for 2 years. So you need maximum time for, if you do not get into first cycle, at least you do not have to redo TOEFL. So give INBDE first, go for TOEFL, aim for scoring more than 90-95. Then you have a good chance, because it is also a very important factor, because they want to see your communication skills, whether you'll be able to communicate with the patients or not. So TOEFL score matters. Go for then the WES evaluation, WES or the ECE. It depends on the universities. Most universities accept ECE, but there are some that want WES. So you can always check online on the PASS portal. And the next, you can see PASS here. This is the portal where you can see all the information for all the residency programs, and you apply through this. So you have statement of purpose, letter of recommendation. So everything remains the same. Your motivation for the program, this all remains the same while you are applying as the CAPIT cycle. Next, you have the supplementary applications. Some schools have these applications which say, now suppose University of Kentucky in orofacial pain had a supplementary application which said, why do you want to do only from University of Kentucky? So there are certain universities that want you to answer some extra questions. Last but not the least, you have some interviews, and then if you're good, you'll get the offer letters. So these were some common questions that I thought I would answer during the session. So what is a typical day for an orofacial pain resident? I have been asked, do I do clinical? What sort of patients I see? So for me, every university, I would like to emphasize this, they have a different rotation plan. Every resident is going to different rotations in every university. In Rochester, I am doing urgent care rotation, specialty care rotation, oral surgery rotation, and we have a separate orofacial pain clinic. So these are all the rotations I'm doing. In urgent care, we see acute and chronic pain patients. In specialty care, we see patients with special needs. So bariatric patients and geriatric patients. We see all these patients who are suffering from pain, acute pain, chronic pain, all this. In oral surgery, we do consults for pain patients, and in orofacial pain clinic, we are seeing all type of temporomandibular joint diseases, muscle disorder, myalgia, myofascial pain patients, and we are doing trigger point injections, we are doing appliances. So we are doing all of this as an orofacial pain resident. So scope of orofacial pain, as I said before, you can practice as a general dentist or a specialist, whatever you like. It's up to you. General dentist license, if you complete the ADEX exam, you have to do INBD. Once you are done with this, you can always practice as a general dentist. Next is Master of Public Health required before applying to residency programs. I think this is being asked a lot, but I would say no. I did MPH not because I wanted to get into residency, because I did it from India. People come to US and then they do MPH and then they go into a dental program thinking MPH is the way to go. If you're motivated to do it and you think it as a second option, then why not? You should do it if you think it is a good second option. If you do not want to go into dentistry. In 2021, when I started MPH, I had no plan to apply for residencies. That's why I did it from India. I had interest in research. I thought I would like to go for a PhD and whatnot. And that's why I started. I had no plans to get into clinicals back. But then while doing that, I realized, no, that is my calling. I need to do something else. So that's why I did it. So it's totally on you. Not that you need to come to US, first do MPH. I know people who have only done BDS and are being accepted to some programs. So you need to build your profile accordingly, but not that you need a specific degree to get into a dental program. So how to initiate the application process? As I said earlier, I know it's very overwhelming, but once you get into it, once you're motivated, you're like, no, this is only what I want, then it's okay. You start with studying a little for INBDE, go for TOEFL, and then start by maybe doing the ECE evaluation, get your GPA, and then go ahead. So it's good. Once you get into it, you'll be fine, is what I'm trying to tell you. Last, how can I enhance my profile for residency applications? As I said, MPH is not necessary, but not that it is not helping. If you are interested and you did it for dentistry, suppose in MPH you are doing a thesis-based program, and then maybe try doing a thesis. Suppose if it's orofacial pain for you, try doing a thesis in pain. So if that's what you want, then do it. But if not, it's not necessary to do it. So if you don't want to do a master's, be involved in research with your peers, connect on LinkedIn, try to find people who are doing research, try to connect. I'm telling you, you mail or message 100 people, not even one will reply. But that doesn't stop you from doing it. Keep doing it, because one of 200 will definitely reply. They'll say no, but then at least you know them now, right? They'll tell you maybe in future, if I have any opportunity, I'll let you know. So you always have, there are free programs that give you free mentorship on publishing a research and everything. So if you are very active on LinkedIn and you want to see, such patients, you want to see and do some research, you can always just go ahead and, you always have a chance if you network with people. And yeah, this was mostly that I wanted to say and tell, but now I'm open to all your questions.
Okay, great. Thank you so much, Dr. Kaur. It was a beautiful presentation, and we do have a couple of questions in the chat box.
Okay.
Let me start by. Okay, so there's one question saying, can an intern apply for residency?
Okay, so you have to have your GPA when you are applying. So I think your college doesn't give you a transcript unless you have graduated. So you will have to wait until you have your whole transcript, and then you can send it for EC evaluation. Once you have it in your hand, then yes, go for it.
Okay. And so there's another question about, when you're applying for residency program, there's something called ADA pass and then there's match. So what's the difference between the two and the process of applying for both of it or, just in general?
Okay, so PASS is a portal through which you apply. So for DDS, you apply through CAPIT, but for residencies, you apply through PASS. For match, there are some programs that are match participating and some programs are not. So match participating is a central portal. So suppose, I think orofacial pain programs do not participate in match. So there are, suppose, 6 programs that are match participating in PROS, but 3 are not match participating. So match participating is a central portal that they will reply you through the match thing. But for directly applying through PASS, it's just university based. The university will separately send you an invite for an interview, or if you are accepted or anything. So some programs participate in match, some do not. Some universities are just not affiliated with match. So they do it separately.
Okay. Okay, so we have another question. I've heard that the residency program is quite competitive in US, so how can a fresh graduate with not much experience can improve their profile?
Yeah, it is competitive because they usually have like maximum, what I know of is six seats for residency, and DDS people are also competing in some universities where they have a stipend. So yes, they are competitive, but during DDS, you can always try to talk to your MDS or the people who are doing masters in your country to involve you in their thesis projects. You can talk to a dental public health or whatever professor who's involved in research in whichever department. Start writing case reports, start going on conferences, presenting papers. It's not that you cannot be accepted without a master's program. If your profile is good enough, they're very happy to take you.
Okay. One more question is that do you require to do ADAT as well while applying to residency programs?
No, it is not a requirement.
Okay. And can you tell us like what made you choose orofacial pain for during your residency, for your residency?
So I did Master of Public Health because I was interested in research. And during that, I thought orofacial pain was a very niche area that not many people explore. And also it got recognized as a specialty in US around 4 or 5 years back. So there are not many orofacial pain specialists. So it's on you how you decide your area of interest. So when I did MPH, it was not very common in India.
Yeah.
So now I did orofacial pain because I thought it is a very niche area in USA, and it can give you, good practice if you go outside after 2 years when there are less people practicing as pain specialists in dentistry. Then you always have a good chance, and it's at the intersection of medicine and dentistry. That was a very major thing that made me selected because I thought, I don't know if I would want to do core dentistry or not. So I'm still not sure. Maybe after 2 years, you never know. So yeah, but general dentistry is always a safe option if you want to practice.
Okay. And can you tell us about like the visa process for applying for residency programs? Do they offer student visas?
Yes, so your university will sponsor you for a F1 visa. So you have to go, if you guys want to write, you can always write it. There is a US immigration portal. You always have to go to that, fill out DS 160 form. Once you fill out DS 160, your university gives you an I-20. With that I-20, you have to go for a visa interview. But in some countries, visa is rejected. I know people whose visas were rejected before coming here, but there are lesser chances in the field of dentistry of being visa rejected. But yeah, visas are rejected. But you have to apply, and your university helps you with it.
Okay. We have another question about, is there a bench test for residency applications?
No, not that I know of.
Okay. And can you share a few tips on how to write a strong SOP?
Yeah, okay. So I would say I will try making a video on this actually because it is a detailed topic, and I think we don't have enough time to talk about completely how to write it. But for SOP, make sure you have a story that looks real. Um, some people write stories that are very hard to believe because if we are paying so much tuition, obviously we are good enough, So in your story, you should be very realistic what you want. So try to start with a very strong background, how you got into dentistry, why you want to do dentistry, and then connect it with the experiences that you have. You don't have to copy your CV. You don't have to do that. But connect your experiences from your CV in that story. So suppose I did research during my internship because it was COVID time during my internship. So I did an online research project with a research organization. So I made a story that during COVID, I felt there was I could see health inequity. I wanted to work on women health. So that is how I connected. So try to connect the dots and write the story, and you'll be good. And the last paragraph, try to make it more about the university, that this university offers this curriculum which aligns with my interest. So that is how you structure it. So first paragraph can be your background. The next two paragraphs can be about your journey. Try to connect the dots, how you came here, what you think, and next connected to the university you are applying to. Try to tailor every SOP for every university. Don't just copy and paste the same. Try to tailor it according to university's vision, according to what they're looking for. You can always read on their page and you'll see how to go about it.
Okay.
Can I
We have
add
another
on a
question
question?
saying, can you throw some light regarding the AAGD program, residency program at Rochester University?
Yeah, so they have a 2 year program track and a 3 year program track. As far as I have seen here, usually the first year international dentists are doing fellowship, and then they go for the 2 year program. So it usually leads to a 3 year program. Sometimes they also stay for 4 years because they do preceptorship, then fellowship, then 2 year. It's a good program. Yeah, I would say they have a lot of general dentistry exposure if you want to do general dentistry. So yeah, it's a good program. It's
Okay.
it's also highly competitive. But yeah, it's a good program if you want to get into general dentistry.
Okay. And how is the interview process like? Is it more in person or virtually as well?
Yeah, most universities are doing it virtually after COVID. Some have it in person. I think somebody wants to unmute.
Yeah.
So,
Um, Kushi, you can go ahead, unmute yourself.
Okay, thank you so much, Dr. Kaur, and thank you, Aster. So you said that the last paragraph would be regarding universities highlights. So isn't we like don't we have to just upload a single SOP on ADA Pass whole application process? So how can we directly reach to college and then
okay, no. So some universities, they have written there for every university you apply, you have to upload an SOP
okay,
once you start
so
doing.
there's a
Okay.
different
So
SOP for
yeah,
every
yeah.
university.
So you're applying it, so tailor it according to their vision. Yeah.
Okay, thank you. And would you recommend, like, how would you recommend writing an LOR, or from which faculty should I get an LOR, like clinical faculty or from
Depending
program?
on what program are you applying to.
Okay.
Mhm.
Suppose I'm applying for orofacial pain residency and I'm currently pursuing a master's in oral health science at Temple University. So should
Mhm.
I get a LOR from my clinical program director or any faculty who is in orofacial pain, or how would it help me?
So I got one from my endodontics director, one from my oral medicine director, and one from my dental school dean. So
Oh,
I got these three. Depending on your program, you should get one from the program that you're currently doing, because you all should always have a latest SOP of who is
mm,
in contact with you,
mm,
and get two from a dental school. Yeah, get from an endodontics professor. Try to get it from people who are involved in pain, right?
pain.
Like
Okay.
endodontics people are
Mm.
involved in pain. So try to connect those dots, and yeah, you're good to go.
Okay. And would you suggest any specific school which are foreign trained dentist friendly, like immigrants friendly or something?
Depends on the program. And I am in Rochester. I can only tell about Rochester, I think. So yeah.
Okay. Thank you so
Thank you,
much.
Kushi, for your questions. There's another question, Dr. Kaur, regarding um, is all the specialties in dental like available for foreign trained dentists, or as in like without doing a DDS, or do you have to have it for certain residency programs? Is there anything such like that?
I think only oral and maxillofacial surgery,
Okay.
only they want you to do a DDS. I know people who got into endo, perio, prostho, orofacial pain without a DDS. I know people. So
Okay.
yeah. So if you have a good profile, you can get into a residency without a DDS.
Okay.
But
We
you
have,
have to demonstrate your interest. With me,
yeah.
in the residency, we have two oral surgeons, oral and maxillofacial surgeons, one ortho, one prostho. So it's very competitive, and
Yeah.
one general dentist. So it is very competitive. So there are
Okay.
they sometimes consider people who have more experience. They want people who have no experience, so that it's a good blend and everybody can learn from each other.
Okay, that is great. So is there a difference with the class size for every other university with the residency program?
Yeah, it is. So I we have six here, but I think Kentucky has three, Minnesota has two. Yeah,
Okay.
class size is
Okay.
different.
So we have another question about could you provide us details regarding the dental anesthesiology residency program?
I don't know anybody, so I think I will not be a good person to shed a light on dental anesthesiology.
Okay. One more question is OPT applicable? If so, how many years?
OPT, dental is considered non-STEM, so OPT is always in dentistry for 1 year. You can always apply for H1B lottery after that, and luckily, if you get it, good. If you don't get it, you don't have to go out of the country. All dentists have an option to work in community care clinics or in universities. With that, you just get a H1B sponsored.
Okay. Um, Dr. Kaur, I know you've mentioned this during a presentation, but I think a couple of them might have joined late. So we have a question about can we practice in all the states in the US after doing residency program? If you just want to like summarize that quick.
Okay, so you cannot practice in all states after doing residencies. There are 8 to 10 states. Suppose if you want to practice in Texas, you can just go to Texas Dental Board, for example. So for any state that you want to see if you can practice or not, go to XYZ State Dental Board. You will be able to see if you can practice. If it's written CODA accredited 2-year specialty program, you're good to practice in that state. Okay, and after 5 years, many states open up to practice. So yeah, after 5 years, you can practice in many states, but once you complete residency, you can practice in 10 states. And my thought process is you will only practice in one state. So this is fine. So it's always fine.
So we have another question about, is GRE required for most of the residency programs?
It's not required.
Okay. But I think I also heard someone say about orthodontic residency do require GRE.
Yeah, so if you're participating in the
Yeah.
match, it might be
Okay.
required. Yeah, so that's why I said go to past program finder and then view the program, and they have written. So mostly I think in some match participating, it might be required. So you'll have to check for every program, what do they require? Because some universities, suppose, only accept students above 3 GPA. Some accept only above 3.5. So everybody, every university here is separate and they have their own eligibility requirements.
Okay. And coming to like the TOEFL score, what according to you is like a very good score while applying for residency? And do they focus on any particular section of the TOEFL score?
No, they don't focus on, as far as I know, as far as the interviews I have given, they just ask you sometimes. Sometimes they don't even ask you for the score, but they'll just see the way you talk and everything, if you're good at it. And the minimum score, I would say, should be above 90. I mean, try to keep it above 90, not that I know people who got into without getting a 90. So it's always a lot of factors that come together. So yeah, but yeah, if you are a fresh graduate, less experience, this is what makes your profile, stand out. So
Okay. Okay. And one more question is, are there any financial aids available for residency programs?
I think some universities, but for international students, I would say like 2%, 5%, not very much. Yeah.
Okay.
You can always work as part-time when you are working as a student.
Okay. One more question we have is like, can we practice in Canada after doing DDS or residency in the States?
DDS, you can. Residency, you cannot. After doing DDS, you can practice in Canada.
Okay.
Mhm.
Oh, all right. One more question would be, how competitive is pediatric dentistry residency program? Will they
I know
accept?
someone who got into pediatrics too, international dentist. So yeah.
All right. Okay. One more question is roughly how much time would it take to prepare for the INBD with a full-time job?
Depends on how much time you are able to invest. If you study 5, 6 hours a day, then 4 months should be enough. 3, 4 months.
Okay. I request like you guys to ask questions regarding the residency programs in specific. We do have a lot of sessions coming up in regarding to INBD in particular. So maybe just try to address questions on basis of just residency programs for now. Um, Okay, so we have here another question about, does the visa type matter? Is and like as in anyone with a passport or a green card will be preferred over people with study or work visas?
No. I mean, I think they have a certain criteria that out of 6 seats, they would give 2 to DDS graduates or that, and then 4 for international. So it's not that internationals don't have a chance. Like I said, I have seen people getting into endo, perio, pros, orofacial pain as international people. I have seen them.
Okay. We have another question on around what time of the year do is the time for applications that are open, and is there anything about early application, like send your application early, or is there anything like that for residency as well?
Applications, pass portal opens in April. Yeah, it opens early April. March, April, it opens. Some universities have deadlines as early as July, August, and some have their deadlines in December. So I highly recommend to submit your application. If it starts by March and April, submit it by July. It's June, I would say. July is also a little late. I mean, just try to submit it within 1 month of its opening. You have a greater chance of being accepted if you are applying early. I
Okay.
was rejected from one university because I applied late. So I know for a fact, if you apply early, you'll get into a program.
Okay. And another question is, when is the interview held for orofacial pain residency in the University of Rochester?
In Rochester, for me, it was in October, on October 7th specifically.
Okay. And do you get like what's your patient exposure like, Dr. Kaur?
I would say it's great in Rochester. For orofacial pain residency, I say it's quite good. So this was one of the reasons that I chose. I had been accepted for 3, 4 universities, but I chose Rochester because they have a lot of exposure in different clinics. So that keeps you in touch even with some procedures that you wouldn't do as a pain resident in other universities.
Okay. And
Mhm.
could you tell us some of your interview questions asked at the university?
Yeah, so every interview starts with tell us about yourself. So it started the same. Tell us about yourself, why orofacial pain, and why not any other residency, why not DDS, and what motivated you to apply for orofacial pain. And for Rochester specifically, they asked me clinical questions. In no other university was I asked any clinical question. Yeah.
Okay.
Mhm.
All right.
Question.
Yeah.
So like you said that you can only practice in 10 states when in US while doing the residency. What are those 10 states?
So I'll name some of them for you, but I don't remember. Also, you specifically have to go to the state dental board. So some of them are Texas, Virginia, Illinois, Chicago, Washington State, and I think Hawaii is one of them. There are around 8 to 10 states that allow you to practice after residency, which increase after 5 years of practicing. After you are done practicing 5 years, then other states such as California and other states also open up.
Okay.
Sorry, your voice was cracking in between. So couldn't hear the scientist could hear the fact.
I think somebody put it in the chat.
Sure.
Yeah.
All right. We have one more. We'll take one more last question. Do we have good job options after pursuing residency in non-clinical subjects to pay off the student loan?
Non-clinical, what do you mean by non-clinical? If you're talking about dental public health, you can only practice in one state.
Non-clinical as in orofacial pain or oral medicine or oral pathology.
Medicine and pathology, I don't know. Orofacial pain is a very, very clinical specialty, to be specific. Yeah.
All right. I think we've answered most of the questions. And thank you, Dr. Kaur, for spending your time with us and answering most of the questions from the people who have joined us today. If you have more questions regarding the specialty of orofacial pain and in general regarding residency, I think you can always reach out to Dr. Kaur and on her social media page, and I think she's definitely willing to help you all. And coming to the questions that I did see regarding INBD preparations, we do have a GroupMe app on which we have a lot of INBD resources, and also a page on study group where you can probably meet people who are also like you preparing for INBD, and make sure you join in there and maybe you could like make the most out of that. All right. Thank you so much, everybody.